Dr. Michael Ryan, answering a question, can I summarize a guide to evaluating leg edema? Edema is a medical word for swelling in the, it could be in the hands, the face, pretty much any tissue can have edema. We're talking about edema of the legs, swelling of the legs. And so it is a fairly common finding in vein conditions. We see it pretty much every day of the week. Uh, but it's also common in a lot of other conditions. So we try to sort out whether we think that the swelling or edema is related to the veins in a number of ways. When we think about swelling, there's a couple of concepts you can review and see if this applies to you. One is whether the swelling is in one leg or two legs. Two legs usually means almost always some kind of a medicine side effect or a medical condition that's affecting your whole body. Is the swelling in your legs as well as your hands? That's similarly likely going to be a medical condition such as kidney disease or heart failure, um, and rather than a vein condition alone. It also could be due to medicines as well. Uh, has the swelling only been there for a few weeks? That is much less typical for a vein condition. Vein condition swelling usually gradually builds up over months to years, and so it's not an overnight process. Another is the swelling related to travel in a car or plane? That's a very common cause of swelling, and usually what happens when people are traveling is not only are they sitting immobile for periods of time, but they arrive at their destination and they're gung ho and having some fun. They're going out to dinner, and people tend to eat. And when they eat at restaurants, there's a lot of sodium and MSG and salt, and that expands the circulation volume and makes their body swell. The thing about swelling from that cause is it takes at least 3 days for it to begin to turn around and to be reduced. Your body is basically wired to hold on to salt because it helps retain your blood volume. Is in that sense, it's kind of a adaptation to survival. So for people that are traveling, that's usually what's going on. It's not usually a medical condition or health condition. Now, the one exception is uh, occasionally people can actually have heart failure or blood clots when they're traveling, and so usually when people are having blood clots in their legs also hurt when they walk. Rarely people have had blood clots from traveling and they leave their legs and go up to their lungs and they don't have uh, any pain in their legs when they walk. But those people have a lot of shortness of breath. So swelling with shortness of breath is a indicator that there may be some kind of problem with blood clots in the lungs, and that really does need urgent evaluation with urgent care, your regular provider or an ER. If the swelling is in one leg, it often means there's some process in that leg. It could be a vein condition. It could be uh, events after surgery, swelling that's very common after hip or knee surgery can lead to swelling, or even ankle surgery. So those are things we look at. The other very common finding with swelling that people are worried about is that, oh my gosh, my swelling is terrible in the summer. It's just so terrible. Well, that is actually what we call physiologic swelling. Physiologic is a medical term that means basically it's functioning as designed. So when in the summer, when you're hot, uh, the way the body regulates temperature is by dilating the circulation to bring blood flow to the skin to help allow the heat to be dissipated or uh, blown off by wind and air. So with that, the extra blood flow to the legs is also associated with extra circulation that results in swelling in the legs. And this is very common. And so when I hear the story that people swell a lot in the summer, uh, they're wondering, what can I do to help them? And even if I do a vein treatment, I tell them that their swelling will likely still persist in the summer. People with a vein condition is very common. They have a typical pattern. The swelling goes away overnight. It's usually from the knees down. and it's always associated with other leg symptoms: aching, fatigue, cramps, restless legs. And very often, as that condition, the vein condition progresses, they also develop fatigue. The fatigue really wipes them out. And a lot of these people are very fearful. They're worried that they're having a heart condition because they're just exhausted. But in the vast majority of cases, it's their vein condition causing their circulation to slow down. One final area is the question about lymphedema. Lymphedema is a type of edema, um, and people want to know, gee, do I have lymphedema? We see lymphedema regularly throughout the week. Lymphedema has some very specific features that you can often self-diagnose. One is the edema, the swelling doesn't go away overnight if you're sleeping flat in bed. If you're sleeping in a chair or recliner at night, and some people do because of back pain or they have breathing troubles or other reasons, acid reflux, those people, the swelling is due to the fact that you have extra pressure when you're sleeping. But if you're able to sleep flat at night and your swelling is persistent, that is a key finding in lymphedema. The other is that the swelling in lymphedema has a very peculiar distribution on the foot. It extends down past the ankle and goes to the top of the foot, and there's a little, as it progresses and gets more advanced, there's a little hump that begins to develop on the top of the foot. And then finally, the edema goes into the toes. There are really no other conditions that except from post-surgical swelling of an extremity after ankle or knee surgery or trauma, where the swelling encompasses the whole leg. There's really no other condition where that swelling persists into the top of the foot and into the toes. So there's some clues about what the sources of edema are. Another is that if someone has swelling in their both their legs and their hands, we want to make sure they don't have a medical cause. And so we want to be concerned with kidney failure, heart failure, and often medication side effects. Probably the most common medication we see is a class of medicines called calcium channel blockers. And of the ones that we see, probably the most typical that causes this symptom is amlodipine. That's a blood pressure medicine, and it does help with blood pressure, but one of the fairly predictable side effects for many people is swelling in their legs. And that goes away after the medicine is stopped. So edema is a complicated topic. There's a lot of things going on. There are some clues that we use to sort out whether their edema is related to a vein condition and whether a vein treatment will help. And in most cases, when you do have swelling due to a vein condition, the swelling significantly improves or resolves after treatment. So, Mike Orion, answering the question, what are the different types of edema?